Hello, my name is Emily Black, and I am a dentist. I led the development of this new guideline on dental emergencies, which will sit both in the medical section and also in the trauma section of the JRCALC clinical guidance on the JRCALC Plus app. So this is actually a completely new guideline covering dental emergencies, and it covers 4 main areas. So it covers dental trauma, dental abscess, dental bleeding, and dental pain. What I want to reiterate is that this doesn't replace a definitive dental assessment, and this should be seen as dental first aid that can be done on scene. The key things within this guideline are a focus on trying to preserve teeth, dealing with timed critical dental emergencies, and there's also some guidance on how to reimplant a tooth if you come across a patient that has what we call a Volster tooth, so it's come completely out of the socket. The guidance also includes some emergency numbers for accessing urgent dental care in England, Scotland, Wales, and Northern Ireland. This guideline's been made because previously there was no dental guidance, and following some feedback, we wanted to develop a resource that paramedics could refer to if you do come across a dental problem. The one that you're probably most likely to come across is someone experiencing dental trauma, with probably the most common being a dental avulsion, and this is a time critical, what we call dental emergency. If someone has a Volster tooth, they may have other injuries that would need to be assessed. However, if someone has lost a tooth completely, there is step-by-step guidance of what to do. The main thing being is we want as quickly as possible to get that tooth back into the socket. We talk through how exactly to do this. If it isn't possible, so for example, you've got a child that's completely uncooperative, or there's something else going on medically, then we want you to try and keep the tooth with the patient, but we also want you to put it in a storage medium. The first one we'd like you to put it in is milk, if that is accessible on scene. You may, for example, come across a parent who might have put it in milk already. If that is not accessible, then I want you to put it in saline, which should be available on the ambulance. But if it isn't, then the patient's own saliva. So this new JRCALC dental emergency guideline, I'm hoping will act as a point of reference so that if you come across a dental emergency and you're not sure what to do, you'll know where to look. So we've already touched on dental trauma, but you may also come across a dental abscess, which can be a life-threatening emergency. In the guidance, we've sort of highlighted some quite dental specific signs and symptoms that you can get if we are really worried about a patient. So a dental abscess in particular can affect a patient's airway, and we've put some nuances in there, which are things like if a patient is completely unable to stick out their tongue, if they're drooling all over their clothes, for example, or if it sounds like they have a hot potato voice, so if there's something pressing on their voice and it sounds like a hot potato. And then there's also a nod to dental bleeding and dental pain, which you may come across in clinical practice. The guidance is written so that it can become a lot more clear about when these patients do need to be conveyed to ED, or when they can be left on scene and advised to seek an urgent dental review. That's why the contact details are in there, which will hopefully make it a lot easier to know where to signpost patients.